Hello and welcome back to Talk to Dr. Sisay's YouTube channel. I'm Dr. Aziza Sisay, and today's video is on breast cancer screening. Now, it goes without saying that so many people all over the world suffer with this diagnosis. And actually, the earlier the diagnosis, the better the outcome. And this is why breast cancer screening is so important. So I hope that you find this video useful. If you have any questions, please drop it in the comment section. But without further ado, let's get started. I want to do another poll because I'm really interested to know what you all think about this next question. So if Zainab, if you could launch the poll. Okay, the question is, can men get breast cancer? Yes or no? And the second question is, do you, both men and women, this is open to both of you, do you examine your own breast once every single month at the moment? All right, we'll have a look at what the answers show in a minute. Okay, so moving on to breast cancer, I thought it would be worth just showing you a little bit of what's inside the breast, okay? So that we have a little bit more of an understanding. Now, the picture I'm showing you is a breast that we're looking at from the side, and we've cut it vertically so that we can see the inside of the breast. And I'm gonna use an analogy. I just want you to pretend, and it does look like it, I want you to pretend that these bits are basically little trees, right? And the leaves of these trees are the ones, so the glands that make the milk, okay? And the branches of the tree are the ducts, which carry the milk out through to the nipple, all right? So these together are called glandular tissue, right? And it's the ducts that the cancer usually starts to develop, all right? Now, in between these glandular tissue is your fatty tissue, so your breasts are surrounded by fat. Now, when we talk about examining your breast, for instance, what feels sort of thready and a bit hard is that bit of glandular tissue that I was just describing. All right, so with regards to breast cancer, it is when abnormal cells in the breast grow and divide in an uncontrolled way and eventually form a growth, which we call a tumor, and that's what we feel as a lump. It is the most commonly occurring cancer in women, but it can occur in men too. So Zainab, would you mind launching the answers? I wanted to see what you all thought. So good, 76% of you said yes, which is good. However, 24% of you said no. And this is why I asked the question, because so many people aren't aware of this. Men do get breast cancer. They only account to 1%. It is really rare in men, but it can happen. And this is why I'd like you all please to pay attention, the men who are watching to please pay attention. It's also important for you to be aware of some of the statistics and the facts that I'm mentioning today. And then, do you examine your breast once a month? Ooh, only 29% said yes. Oh dear. Okay, we'll have a chat about the importance of that in a minute. Thank you so much for participating and doing the poll. I really appreciate it. Okay, so breast cancer causes one of the greatest numbers of cancer-related deaths in women. So about 15% of all the cancer-related deaths in women are due to breast cancer. And around 55,000 people are diagnosed with breast cancer every year in the UK. That is 150 new cases every single day, which is really scary when you think about it. And unfortunately, breast cancer cases have been continuously rising over the years, and it's said to continue to rise as time goes by. Now, it's said that 1 in 7 women in the UK develop breast cancer during their lifetime. It's actually 1 in 8 when we think about the whole world. And it's the 4th most common cause of cancer deaths in the UK. Breast cancer survival is improving, and it has doubled in the last 40 years, which is a positive. And as with everything, I hope you're seeing the pattern. Survival is much higher when breast cancer is diagnosed at its earliest stage. So 98% of women who are diagnosed with breast cancer at the earliest stage will live 5 years or more, compared to only 26% who are diagnosed at the latest stage who will live 5 years or more. Okay, so what are the risk factors of breast cancer? Now, I'm sure all of you can answer the first one, being a woman. 99% of breast cancer occur in women, unfortunately. Also increasing age, so 80% of breast cancer occur in women over the age of 50. Obesity and being overweight also contributes, and this is because it has to do with sex hormones. So breast cancer is thought to be increased if you have a higher amount of sex hormones in your system. And being obese and overweight increases the amount of sex hormones in the system, particularly if it's around the tummy. Now, this is really important, especially when it comes to men, because it increases the overall risk by 30% if you're overweight or obese of a man getting breast cancer. Smoking and alcohol also increase the risk because, again, they increase your sex hormone levels. And then family history. Now, if you have a close relative, so when I say that, I mean either your parents, your siblings, or your children who's had breast cancer, it increases your risk by 2 times. So you're 2 times more likely to get breast cancer. Now, having said that, it's really important to know that 85% of these people who have a family history will never get breast cancer, okay? And 87% of the people diagnosed with breast cancer don't have a family history of breast cancer. So I'm saying this so that you're aware of the fact that just because you have a family history of breast cancer doesn't mean that you will 100% get breast cancer. And also, if you don't have a family history of breast cancer, it doesn't mean that you definitely won't get it. So it's important to remember. And there are also genetic factors. So you may have picked up a faulty gene. I don't know if some of you may have heard of BRCA1 and BRCA2 mutations. So they increase the risk of getting breast cancer if you have these faulty genes. And then ethnicity. So white people have a slighter risk, higher risk of developing breast cancer. However, Black women are found to have the worst cases in that they have the most advanced, most aggressive cancer that occur at the younger age. And there's still not much understanding as to why this happened. There are loads of suspicions, as we said before, socioeconomic factors, lifestyle factors, and so on. But it's still quite significant. Minimal activity. So exercise is said to reduce the number of sex hormone in your body. So if you're not exercising, you increase your risk. And then if you have quite dense and a lot of breast tissue, so this increases your risk of getting breast cancer by 3 to 5 times. So other risk factors include when you started your period, for instance. So if you started your period at a younger age, it increases the risk. And if you finished your periods at an older age, so if you go through menopause at an older age, it increases your risk. And to do with childbirth, if you have had your first child at an older age, that increases your risk. If you haven't had any children at all, again, that increases your risk. And if you've never breastfed, that could increase your risk of breast cancer. Now, certain operations, so if you've had your womb or your ovaries out, that helps, that actually reduces the risk of breast cancer. And then there are hormonal medications. So we've said that sex hormones, if you have a lot of it, increases your risk of breast cancer. And that's technically what we're giving you when you have your contraceptive pill. So it increases the risk by a small amount, though, only 1%. And they say that after you stop with it, after 10 years, you're back to normal risk, normal everyday risk compared to everyone else. And then HRT, so the hormone replacement therapy that we give women who are going through menopause, it increases the risk by about 2%. So symptoms of breast cancer. Now, I'd like everyone to please look at this screen and focus on it, because the symptoms are more what we see and what we find, okay? So they could include either you've noticed a change in the size or shape of your breast compared to what it used to be. Maybe you notice a lump or an area that feels a bit thicker or different to the other parts of your breast. Maybe you noticed a change in your skin texture of your breast. It's a bit harder or thicker, and perhaps it's dimpling, so it looks like the peel of an orange. Maybe you notice a bit of redness or a persisting rash around the skin of your breast or around the nipple particularly. And if you notice that your nipple has inverted or gone into itself when that wasn't the case before, because for some women having an inverted nipple is normal. And then if you notice any liquid or discharge coming out of your breast, if you're not lactating or breastfeeding. And if you notice a persisting pain that's not going away within your breast and around your armpit. And finally, if you notice a swelling in your armpit or around your collarbone. These are all sort of symptoms and signs of breast cancer. I want to say here, I do apologize to the men. I keep saying you. It's because I'm so used to talking directly to patients. So bear with me if I say that, okay? All right, now I'm talking to everyone here with regards to breast and the importance of breast examination. And I'm really glad that you're here to watch this, because yes, only 20% of you say that you examine your breast every month, and that is the recommendation. You need to examine your breast every single month at the same time every month. There's even a catchphrase that's been tagged as feel on the 1st. So today is the 1st of November. We're gonna examine our breasts from today, right? So 1st of November, 1st of every month, see if you can examine your breast, or choose a time that suits you once a month and the same time every single month, okay? And this is not necessarily to find abnormalities, it's just so that you can understand what your breast looks like normally, okay? And then that way you can pick up if something looks abnormal. So I wanted to take a little bit of time to talk you through how to examine your breast, because I think it's really important. And this is the same for men, so please do pay attention, okay? So the first thing you would need to do is look in front of the mirror. So you would have to take off the top half, so your bra, everything, you're naked from the top. And then you'd stand in front of the mirror and you'd look at your breast with your arms in 3 different positions. So your first one will be on the sides like this, and then you put your hands on your waist like this, and then you put your hands over your head like this, and you can lean forward so that you can see if there are any lumps or bumps that is visible, or if there's any rash or skin changes, the things that I just mentioned, okay? So take some time to look at it, and then you can look from the side as well. And then the next thing you do is you feel. So you can either feel by lying down when you're in bed, or you can do it whilst you're taking a shower, and the soap will help to make it just a bit smoother to examine the breast. So what you would need to do is put one arm over your head like this. Now, I'm giving you a tip for one way to examine your breast, but as long as you're doing something similar and you're feeling around, that's what's most important. All right, so you put one arm over your head like this, and then I want you to imagine that you've cut your breast into 4 sections, yeah? And that way you can concentrate on each of these sections, and you would use the flats of these 3 fingers, yeah? And you would feel around in a circular motion. So you'd start from the nipple and feel around all over, okay? And then you make sure that you feel up here, up to your collarbone, to your shoulder tips. And then make sure that you also feel inside your armpit. And then make sure that you're feeling in the middle, like that. Okay, and you do the exact same thing on the other side. And if you find a lump, then what you need to do is examine the other side, because it may well be that that's what's normal for you and it's nothing to worry about. But if you do find something, please see your GP. We'll see you, we'll examine you, and then refer you if we feel it's necessary. All right, so what are the available breast cancer screening tests? Now, we've just spoken about one, breast examination, which you can do by yourself. It's free and you can do it in the privacy of your own home, but the specific tests include a mammogram. So this is where you get x-rays of your breast taken, women. And this is what the machine looks like. So it's two plates, and they put your breast in between the two plates, and then they would, it would press against your breast to get the images. And they do the same thing once they move the machine to the side, so they can get images of the side of your breast, and they do it to each breast. Now, the other test includes MRI scan of the breast. So this is the position that you would be, and then you sort of pushed into the machine, and they'll, as well, again, they would get images of what your breast tissue looks like. It's not as sensitive as mammogram though. All right, so the aim is to find breast cancer early. And unlike your cervical cancer and bowel cancer, it doesn't prevent breast cancer from occurring. It just hopes to find it early when you can't necessarily feel it. So when it's a lot smaller. So the good news about breast cancer screening is that it reduces the number of deaths from breast cancer by about 1,300 a year. And that's the case in the UK, it's about 20%, which is significant. Overall, the breast cancer screening program finds cancer in about 9 out of 1,000 women who have screening. So only 1% of people who have the screening done, only 1% usually are found to have breast cancer. Now, the sad thing about what's happened in the UK recently is because of COVID-19 restrictions, a recent article came out saying that 1 million women have missed their mammogram appointments. So it's a bit scary. We're hoping that we then there won't be any implications, but we'll have to wait and see. It's a very difficult time. Okay, in the UK, who gets invited? So it's women between the ages of 50 and 70. But in England, they're now seeing people a bit earlier and a bit later. So the range is a bit wider. Between the ages of 47 and 73, you must be registered with a GP, and you get screened every 3 years. You get invited every 3 years as long as it's normal. And you can request for breast screening over the age of 70 if you're concerned. Just speak to your GP. So what happens, we briefly discussed again that we're going to get 2 images on each breast, the top and the side. And that way we get an idea of what's going on within the breast tissue, and you often get the results in 2 weeks. I want to say that with regards to having a mammogram done, it can be a bit uncomfortable for some women, and some women do find it painful, but it's quick. It doesn't usually last that long, but as you've seen in the earlier slide, it does save lives. Okay, breast cancer screening, the results could be normal, and you go back to routine screening, or it could be abnormal, and this happens in about 4% of women who attend the breast cancer screening. And then this way, you're normally called in for more tests, which includes having a mammogram again, or an ultrasound scan, or they may do a biopsy, so they'll get a sample of your tissue. They may do an MRI scan. And basically, after review, 4 out of 5 of the women who are called back didn't have breast cancer. So it's just to reassure you that just because you get called in saying that your mammogram report is abnormal, it doesn't mean that you have breast cancer, okay? And the results could be unclear, and then unfortunately, if that's the case, they would need to repeat the mammogram again. All right, just to quickly talk about breast cancer screening in high-risk groups. So these are women who have a strong family history. So they get screened differently. If you're over 40, you get a mammogram every year. And if you're under 40, you get an MRI scan every year between the ages of 30 and 40. And the reason being is usually under 40, your breast tissue is quite dense, and it makes it difficult to be able to see things quite clearly on the mammogram. So that's why they do the MRI scan as well. And then if you have a faulty gene, you will have an MRI scan every year, either from the age of 20 or 30, depending on what type of faulty gene you have. All right, we've reached the end of this session. I really, really hope that you found this useful. I'm really passionate about it. I hope that you can tell, because it can really, really make a difference, and it can save lives. Now, I always end with a take-home message, and my first one is know what's normal for you. understand your body, okay? Try and do the examinations, as I say, you know, examine your stool if you feel like it's getting different, that sort of thing. Nobody knows you more than you. And then seek further advice from your doctor if you're concerned about something, anything. Just let us know and we can guide and advise you and hopefully reassure you as well. Please attend your cancer screening invitations. Now, it's not compulsory. You have complete choice as to whether or not you want to attend. Now, I'm hoping that through these sessions on cancer screening, I've encouraged you to attend the sessions. I hope so, your screening appointments. And another important take-home message is a healthy, balanced lifestyle is paramount. So 30% of cancer deaths could be avoided just by changing your lifestyle and having more healthy behaviors. So things like stopping smoking, minimizing the amount of alcohol you drink or don't drink at all, exercising, losing weight, all those things can reduce your risk of breast cancer. There was a lot to take in with that, I know. But I really, really hope that it's given you some insight about breast cancer in general and also about breast cancer screening. And I hope it's encouraged you or given you that encouragement to attend your appointments. So it's all about, as we say, living that healthy lifestyle, knowing your body. Please, please, please examine your breast at least once a month. Feel on the first, as they say, or cup of feel. And the examination shouldn't take long. It's quite basic. You can rewatch this video. I hope you found it useful. And as always, if you have any question, please, please drop it in the comment box. And hopefully see you in the next video. Take care. Bye.